Tuberculosis is a commonest chronic granulomatous condition, and it can affect the larynx also. 95% of the patients, they be already suffering from pulmonary tuberculosis, and secondarily, it can affect the larynx too. So in this video, I'll concentrate mainly on tubercular laryngitis. The usual complaints are the patients will be saying that they were having evening rise of temperature and night sweats for a long time, along with loss of appetite. And of late, they have started getting change of voice, and it will be a weak voice associated with cough and odonophagia also, which means whenever they eat, it's painful for them. And some of the patients may complain when they cough, there's blood stain in that. So, with all these complaints, we'll go ahead and do a laryngoscopy, which hardly takes few minutes. And the laryngoscopic findings I'll tell you. See, this is a normal larynx. This is the epiglottis. These are the vocal cords. So what happens is, in tubercular laryngitis, it starts from the posterior aspect. The whole larynx will be pale. You have seen in the interadenoid area, and not only in the interadenoid area, it can be in the vocal cords also. Then as the stage progresses, they may develop ulcers in the vocal cord to start with from one vocal cord, and the edges of the ulcers will be irregular in shape, as if we term it in medical terms, we call it mouse nippled appearance. And it will progress to the other side also, and the turbinates, it will enlarge, and it will have a particular shape. We call it turban shaped epiglottis. So it starts from the posterior to anterior. When the TB lungs, it affects the one nerve which supplies the vocal cord, it can result in vocal cord palsy also. So these are the findings when you do a laryngoscopy. Now, as far as the investigations are concerned, we'll start with CBC and ESR, and of course the ESR value will be high, and we'll do a Mantoux test where purified protein derivative will be injected intradermally in the inner surface of the forearm. We'll wait for 72 hours, and after the waiting period, we'll check the induration and the report will be issued. Not only that, we would go ahead and do sputum test, and if suppose sputum is not available, the patient is not able to bring it out properly, we need to do bronchoscopy and bronchial lavage and aspiration of the sputum and send it for AFB stain, Ziehl-Neelsen stain, and not only that, PCR study too. The latest being CB-NAT. Chest X-ray will be taken, and blood test will do a quantiferon TB gold test. The gold standard of diagnosis, if suppose all the other tests turns out to be negative, then we can go ahead and do a biopsy of the laryngeal nodule. This is just one day admission. We'll do a laryngoscopy, we'll take a biopsy from the laryngeal nodule. If any of these tests come positive for tuberculosis, then you will be referred to the area TB center, where they'll do a couple of blood tests, eye examination, liver function test, and they'll start on anti-TB regime. So the anti-TB regime is the same as for if suppose the patient is suffering from pulmonary tuberculosis, the regime is same for tubercular laryngitis also. So initial 2 months, we'll start with all the medications, and all the dosage, everything will be informed. And for next 6 months, one of the medicines will be reduced, will be stopped, and we have to continue the medication. So each medicine, how many times it has to be taken, when it has to be taken, and the side effect of each medicine will be explained in detail. And not only that, you have to review regularly for eye checkup and for normal blood routine examination and liver function test too. because all these anti-TB medications, they have got side effects. To monitor that, we need all these tests. And from the one more most important point is voice stress is very important, and you have to take normal diet, balanced diet. Try to avoid oily foods, hot, spicy foods, and cold items. I'm repeating, voice stress is very important, and multivitamin tablets along with B complex will be given along with the anti-TB regime. So that's how we manage a case of TB laryngitis. Thank you so much.